Thank you, Ginger. Just listening to Dr. Alinsky and his presentation, very comprehensive. Thank you so much. And bringing us up to date with what they're doing so far. I feel like LBJ is 1,000 years, light years ahead of DOH, but we're doing our best to meet the needs of the population as well as try to be more developed than what we were 5 years ago. Okay, without further ado, second slide, Ginger. Okay, so the goals for telehealth within the department is to increase access to specialty and primary care. So Dr. Alinsky did mention that there's a lack of specialty. And so whatever we have at LBJ, that's all we have. And so we try our best if there are certain cardiologists or even Shriners with the orthopedic, when they come down for a visit, we make sure that our families have access, that our families have appointments, and we touch base with LBJ to make sure that they get those services. Improve health outcomes, improve continuity of care. A lot of our referrals off island do come back, and then we have our nurses do home visits. And so to make sure that they go back to LBJ for their continuity of care. So that's some of the things that we would love to build upon with telehealth. Increase patient satisfaction, increase provider satisfaction, as well as a cost reduction and decrease need to travel. Next slide. So who is utilizing telehealth opportunities within the department? We have our medical staff. So a lot of us utilized telehealth for CME, telementoring. Really what we have is within our department and the CME at LBJ. That's all we have. And so we do need to learn a little bit more what's going on in the world, especially with COVID. We need specialists to actually learn from, epidemiologists, what you call pediatricians, gynecologists, all those folks under oncologists who can provide best practices and how to manage our patients better. We use that. Long distance learning, early intervention therapy sessions. Some of our programs within the department also utilizes telehealth for therapies. The TB program, tuberculosis prevention and control, they also use DOT during the time when there was a lot of restrictions on island. And so the nurse is also our epi nurse. She's also our epidemiology nurse. So she does get sent home for those who were self-quarantined to also monitor these patients. And she didn't have enough time to be going from home to home, as well as making sure that her TB patients were taking their medication. So for anyone who had a smartphone, tablet, computer, who can get on and, for her to observe that they're drinking their tablets, she would utilize that. And so it might not be as HIPAA as it should have been, because she would use Facebook Messenger. I'm sorry, I'm serious. But honestly, that's the only way that she could use. She would take that. And so she would use that to, as long as she sees that you're drinking your medicine, it's good with her. So shortage of staff, we really need to utilize telehealth. As well as programs, like I mentioned before, early intervention programs also utilizes telehealth. Next slide. So going on to part C. So this is our early intervention program. They cater to kids who are 0 to 3, and any child, whether it's a referral from nursery from the pediatrician or from providers in the clinics that see and can tell that there's a developmental delay, they refer them to this program, and this program takes care of them. So it's consensual. If the families say yes, then they go in and they do a lot of home visits, coaching. And so the developmental delay can be any one of these things. Can be physical, cognitive, communication, social, emotional, adaptive, all these little skills that they see that the child needs help with, they go in and provide therapy. So they utilize telehealth especially for services such as behavioral, OT, occupational therapy, as well as speech. So they have specialists across the nation. I'm not sure which of the state each individual therapist worked from, but they utilize that. If the family doesn't have data, doesn't have internet, then they go in with their MiFi. If they need any equipment, whether if it's an iPad, they usually use iPad, and they take it in, they sit with the mom or the caregiver and the child, they turn it on, and the therapist will be on. And so if they need translation, the staff or the home visitor will be there to translate and help out with that. The only service that they do provide locally is the PT. So I think on the right side, you can see Dr. Joyce Ursulino. She provides PT for their kids. Okay, next slide. So the other thing that I value is our regional partners. So our regional partners do provide technical assistance, whether it's training to provide needs assessment. So I have this picture here. This is from my program. This is HRSA, as well as CDC. So this year, our application is due for our 5-year needs assessment. And so before COVID, we were fortunate that our trainers came down and did, hands-on training for basic screening survey. So in order for us to determine what our health priorities were for our women and children, and including children with special healthcare needs, we had to do population-based surveys. We had to do jurisdictional surveys. We had to utilize any kind of population survey already done that was very recent, such as the NCD hybrid survey, behavior risk, youth behavior risk surveys, anything that we can utilize to determine what are the health needs on island. And so for MCH HRSA, they sent down our health epidemiologist to do our training. And then we had our community health center dentist went out and do our health screening. So in my bio, I have not been working as a dentist for the past 6 years. I've been working as an administrator, but I do miss it. I do miss going out to schools and providing preventive care. And so one of the things that was identified in our most recent oral health survey was that tooth decay is still high. And we gotta find out innovative ways, at this time during COVID, what are our evidence strategies that we can utilize? Schools might be closed. So what are ways that we can get across to the families to keep brushing their teeth, to eat less sweets, all those things. So we're trying right now, we're working on what are some strategies that we can put into our work plan to make sure that our, best way to communicate through social media, through the radio, or through Zoom, some way that we can get across to doing, because public health is all about prevention, health education, and promotion. And so these are some of the things that, all the programs within the department are trying to find ways to reach out to the community through this COVID restriction. I know that there's no case here on island, but we're trying to practice for when for that code yellow. I think that's the next code. So those are some of the things that we're currently working with our regional partners. So the other thing that's going on right now is the epidemiologists. They're having regional meetings, calls, weekly, bi-weekly, monthly with PIHOA and CDC to make sure that whatever is working in Guam and CNMI who actually have cases that we're gonna use here, learning from what's going on in Hawaii or in the other Pacific jurisdictions. Even WHO and SBC links us to Fiji, all the other non-US countries to learn from what are they doing, and making us better prepared for border protection and all that stuff. So that's ongoing. So there are also regional partners that's also, helping us through telehealth to make sure that we get things done and that we're better prepared. Next slide. And so one of the things that was fairly new within the department was RHD telemedicine. So one of the things that we got together with the pediatrician from LBJ and realized is that a lot of the kids are not diagnosed as early as they should be, and we need to do something about it. And so one disaster or one public health emergency led into this beautiful story. So there was a Zika outbreak in 2016. And so there was an opportunity for Department of Health to get financial assistance to help out pregnant women, as well as to monitor their babies when they're born, all the way up to 3. And so we were fortunate to utilize that funding to get ultrasound machines. At the time, it was supposed to help do head ultrasounds for babies, but by the time we got the equipment, all the babies were born. It was pretty much too late to go back. They were already fully formed and everything. So what we did was we utilized those ultrasound machines to do echo scans for children, for school children who were not diagnosed early, to make sure that they get their Bicillin shots before they get into heart failure. And so some of the things that we managed to do now currently is that we utilize the ultrasound machines. We had folks coming down and train. So we did get some folks from LBJ, as well as folks here in DOH. And so they were trained to utilize the machines, go out into the schools. So most of the time when they go out is when the cardiologists come down. So when they go out together, they screen as many kids as they can. And then what is done with the pictures that they take is that it gets stored into a cloud-based HIPAA-compliant storage, where cardiologists off island go in, they look at the results, and then they diagnose and then send back. And so for every positive case that they sent back, our pediatricians get to say, okay, you're gonna be on Bicillin right now. So one of the things that we, with the help of our pharmacist, Dr. Francine Amoa at DOH, is that we were able to apply and be approved for a 340B program. So these are very low discount pharmaceutical companies that give us things for cheap. I mean, it's really cheap. The cost of the shot is like 20 cents. So in order for us to be eligible, we had to utilize local funds. And mind you, DOH is a lot is federally funded. So we were fortunate because of our promotion and our health education. Some of the school kids on island, they got together and they did fundraising, and that money was given to us to get, Bicillin shots for our kids. And so that is what we're utilizing right now. And we haven't even used like $100. We sent to the company about $3,000, and we haven't even used up to $100. And so right now we're giving shots in Tafuna to kids all over the island. There's about 157 kids. And so it ranges from 3 years old all the way to 18-year-olds. There are some adults that were screened while at school. They would come with their kids, and then we're asked if they can also get screened, and unfortunately found out that they had RHD. And so we were willing, because they went through our program, to also be on Bicillin shot. So that's the beauty of telehealth, is having cardiologists diagnosing from the mainland, through these pictures or images that we take locally. Okay, next slide. Okay, so there are other projects that are ongoing that, for learning for our physicians, so that they can, and these opportunities, they can actually have current cases that it's hard for them to diagnose or manage, that they can also present during this session. So that's the ECHO project. It's like nationwide, but we usually attend the Hawaii Rural Health Association's ECHO projects. And so ECHO stands for Extension for Community Healthcare Outcomes. And so one of the 3 things that come to mind, because I keep on getting repeated emails, is cancer, behavioral health, and geriatrics. And so all of our physicians receive the same email. And so I haven't had a time to evaluate how many of them are actually going in, because this is during their working hours. It's not like we asked, especially, can you come in at 7:30? Mind you, Hawaii is like an hour ahead. And sometimes the session will be during lunchtime. And during that time, that's the most busy time for the community health centers. So the beauty of this is that it's recorded and it's online, and they can go back and replay it. Next slide. the AAP Project Echo. So this was ongoing. This came into our attention during Zika. But you know, the ECHO project is anything that is an emergency that's ongoing, or like, you know, that really needs information or best practice to be better informed. And so I some of the pictures here, I don't know if it's clear, but we had it all the way back in 2017 during the Zika outbreak. Pediatricians across the nation, even remember it's Zika, the main numbers were coming from like South America and Puerto Rico. So we had heaps of clinicians that came online, and, you know, and we had the opportunity to also present. Unfortunately, well, the great thing was we didn't really have cases. So that was the beauty of it. We had positive moms, but babies were not positive. So that was the great thing about it. And it's ongoing on today. So they do have sessions that are talking about what are the various things that they can see among kids nowadays because of COVID. And so those opportunities are also ongoing for distance learning. Next page. The same thing as CDC. So CDC also has like weekly calls, COCA calls. So it's clinician outreach and communication activities. So I feel like even though we're in this remote little island, it doesn't prohibit us from learning a lot more of how we can manage our families and our children here on island. Okay, next slide. Okay, so some of our strengths. So with the sticker funding that we had had to like ask Ray. You know, we did our homework. We went to Ray and asked him, what kind of equipment do you guys use? Because, you know, we're thinking of using the same thing, but we don't want to use something that's totally different. And if we need to fix it, we don't know who to ask. So we were told, go straight to Ginger and, you know, and those are the folks that can help you out. And so with that relationship and the network that we were able to furnish all of the community health centers with telehealth equipment. And so, yes, teleconsultations is possible. It's just that our physician just needs to utilize the equipment. So next slide. Some of the challenges, I believe, like Dr. Olinsky, like kind of like already went through the challenges. We all share the same challenges, but, you know, I feel like our bandwidth within GOH is way, way less than LBJ. And, you know, there is a shortage of qualified HIT staff. Now we went from 1 person to 2 people. And I hope that with those 2 people, they can, you know, develop some great policies, build our infrastructure, because we still have a lot to improve on. Next slide. You know, I really love that Dr. Lindsay has a lot of ideas. So you know how you get memories out of Facebook? So I think this was just like a week ago, this popped up, and that's a memory from 3 years ago. So I had one of my grant review meeting in Hawaii, and I made the effort to call Ginger, and I said, oh my gosh, can I just come over and see what you guys have over there, and then give me a quote or like a vendor so that I can go and ask them for the same equipment. And so 3 years ago, we had this dream. I don't know if Susan from Shriners remember me, but 5 years ago, I went on a tour at Shriners, and she gave me the tour, and she even showed me this little room where they bring their patients in, or the physician in, and would call here, American Samoa, and they would look at the, you know, the patients for follow-up. So I was thinking, I had this dream, and I'm like, oh my gosh, you know, I had this dream that whatever equipment is here at Shriners will be there in American Samoa, in DOH. And so 2 years down the line, I went to UH. They showed me all of the stuff that, you know, all the stuff they have, and we might not necessarily have everything that they have, but I feel like we have the basic and the capability to do this together. So Dr. Olinsky, your ideas and your dream, it can become a reality. So keep talking and keep making those great ideas there at LBJ. Thank you.